Hi, Dr. D. Pasquale with NSI Stem Cell, and I was in the process of shooting a video for type 2 diabetes and a literature review. And one of the things that dawned on me is we talked briefly about, mast cell and the conversion of M1 to M2. Mast cell is basically a macrophage, which is a portion of our immune system. Macrophages eat things up. So when a foreign body comes in, they're the first line of defense, so to speak. But for those individuals that suffer with like a Lymes disease infection or possibly chronic fatigue type of syndrome, we get what's called mast cell sensitivity. And essentially what happens is there are certain types of mast cells, M1, that are basically pro-inflammatory. And when there's a high amount of M1 mast cells present in the body, we have an inflammatory process. And what's interesting about stem cell therapy and what we're finding in terms of mechanisms is stem cells have a direct interaction or a direct effect on our immune system, and they can regulate things like the conversion of M1 to M2. So when we talk about diabetes, one of the interesting things about diabetes is that there is an autoimmune component to that disease. It is a diffuse metabolic condition, so our immune system plays a role in everything that we do. Essentially, with diabetes, one of the mechanisms by which we can help diabetes is the conversion of M1 to M2 or a more anti-inflammatory state. And I just wanted to touch base because I know a lot of patients suffer with other conditions that are consistent with mast cell sensitivity. Lymes disease is one of them. And I just wanted to kind of briefly discuss that because I think it's beneficial. In terms of overcoming a problem, you have to educate yourself, you have to get the information necessary to help you achieve your goals. And we believe that stem cell therapy should be part of the regimen, at least in a natural kind of environment, so that we can help people improve the quality of their lives.